Hi, Dr. Pelto here. I want to go over a little bit today about bunions. This is for you if you've had problems with bunions, you want to learn more. One of the big questions I think it's important to ask is how long have you had your symptoms? If your symptoms have been short lived, it may be a question of shoe gear, and we're going to talk about that. But if it's been a long time or if there's a family history of bunions, then it may be more indicated that you'll need some type of a procedure or intervention. What have you tried before? Have you tried different shoes? Have you tried toe spacers? Have you tried other treatments? How does this impact your life? Does the bunion bother you? And not all bunions need to be treated. If a bunion doesn't hurt you, you don't have to do anything. So we're going to go over today, how do you kind of determine what's a severe bunion, what's a moderate bunion, and what type of treatments are there? So first of all, the causes. Normally we see bunions can be caused from inheritance, from family or parents. A mechanical instability in your foot or an unstable foot or tendons can be pulling harder on one side than another. And then poor shoe choice and also posture and tightness in general. How do you evaluate bunions? I like to look at a bunion as a mild, moderate, or severe. It tends to be moderate or severe when it starts to involve the second toe. Many people can also have hammer toes or other things that go along with the bunions. It's important to look at a bunion when you're standing up as well to see how the feet kind of splay out with the bunions. I like to use this checklist, and this can show kind of different imaging angles, and we'll show you this in the office if you have a normal angle, if you have a larger angle, or a really, really big angle. When I do that, the first thing we start out with is an x-ray so we can evaluate, then we can see if there's any progress over time or if it's getting bigger over time. An ultrasound might be needed if you have a bump on the side. If there's a big kind of a bump that's inflamed and red, that might need a cortisone injection. The traditional treatments I find to reduce inflammation, if you have had this maybe due to a poor shoe, you might try icing or anti-inflammatories. If there's a bursa or a little red like thing on the side that's painful, you can try a cortisone injection to the side or inside the joint. Physical therapy can sometimes help. A walking boot if it's really inflamed. The non-surgical treatments, first is a wider shoe, not necessarily wider, but more of an anatomic shoe. Okay, a toe spacer or correct toes. We'll talk about that a little bit, and then bunion pads. You can help improve the joint movement with a custom orthotic by adding something called a Cluffy wedge under it. It's going to help the range of motion of the joint better and have less jamming. And there's different types of surgical procedures and additional procedures that might be needed, or different types of bunionectomies. We'll get into that as well. I want to start by just showing a picture of a girl. She was 11 years old and a 17-year-old. You can see this is a very wide foot. This is a beautiful foot, very anatomic, very wide in the front. Now, if this girl would wear tight shoes, she would have developed a bunion because it would have pushed things over. But luckily, her father, who's a podiatrist, had her wear appropriate shoes, more anatomic shoes, and she never developed one. Whereas this is her mother. Her mother did have a bunion because of very similar foot, and she had a bunionectomy because of it. So these tighter shoes can cause pushing over to the toes over time. And hopefully we can keep the younger patients in a shoe that's appropriate so it won't squish things together with a shoe like this. You can see the foot almost like forms to the shoe. So shoe choice is key. You can see 2 feet, very similar, straight toe, but with the shoe on, it pushes things over. And this is an example of an anatomic shoe. What I recommend is you buy a shoe and then take out the liner. That's the thing that has the name of the shoe written on it, and step on it. And if your whole foot's within it, then it's probably appropriate. If it's not, it's probably inappropriate, and it could contribute to developing a bunion. There are some other things that can happen with a bunion as well, such as a hammer toe, a tailor's bunion, or pain to the front of the foot, or called forefoot pain. These are other problems that happen in conjunction. So what are the initial treatments? Anatomic shoes. This is an example. This is a Lems. A couple other brands that I like are Topos and Ultras. If you want to go to my website, drpelto.com, there are some shoe recommendations. There's my shoe buying guide that has anatomic shoes in there. You can try a toe spacer. Correct toes if you want to try to hold things in the proper position. Once again, I don't think correct toes reverse bunions, but hopefully can make it from getting worse. I don't find that those bunion splints, the ones that you wear at nighttime, this big strap, almost like a tongue depressor pulling things over, I don't think those work all that well, in my opinion. In my opinion, I think there's three reasons for surgery. If you have skin breakdown or an ulcer, if you have pain, or if you can't find shoes that fit, and if you try the appropriate shoes, that would be a reason to do surgery. I want to give you some examples of some surgical procedures. If you have a smaller bunion, you may have this type of a bunionectomy, which is a distal bunionectomy to shift things over. If you have a lot of arthritis, it may just be beyond a bunionectomy. You may need some other type of surgery as well to help fuse that joint. If you have a bigger bunion, you may have to have it fused at the base of the foot. And if it's a really bad foot, you may have to have the bones corrected. This is called metatarsus adductus, and sometimes this needs to be corrected and toes need to be aligned. That's a very challenging bunion to correct and has a long recovery for it. So once again, this is just a quick overview of bunion surgery. Certainly, if you would like treatment or see someone, you should see your podiatrist. And if you want more information, go to drpelto.com, and I have some great resources, a shoe buying guide, and some other resources on bunions there. Okay, thank you.